came to dental office complaining about the sensitivity of the upper premolar. She said, I have pain every time I drink something cold. So doctor, please do something for my tooth. Okay, fine. Okay, first I will make a diagnosis. Then, okay, I found your tooth, titanium deficiency. So I need to extract the tooth and place an implant. This is the solution to it. So he, instead of doing vital guard therapy or root canal treatment, he extracted the premolar and placed an implant. This is the right way to do it? What do you think? I don't think so. Why he extracted the tooth? Why? Money, right? Yes, of course, money. So that's why you have to be expensive to stay motivated to save the tooth. It's very important. If it's cheap, nobody is interested in saving the tooth. You have to be expensive. Very, very important. If you keep doing like that, you could have an accident like this. But if you try to save the tooth, this would not happen. Okay? This is the difference. Very, very important to save the tooth. So that's why I want to show you how to make an accurate diagnosis. So first, I want to talk about pain management. It's very important, like I said earlier, to make an accurate diagnosis before you touch the tooth. So how to differentiate non-odontogenic pain? It's crucial to differentiate odontogenic pain from non-odontogenic pain before you touch the tooth. Very, very important. If the pain does not come from the tooth, you'll be in a big trouble. So how do you improve the success rate in retreatment or even initial endodontic treatment? You need to start with an accurate diagnosis. Then you can remove the infection and you can prevent deep infection and root fracture. This is the procedure you have to follow. I mean the protocol. So always you find it always bacterial infection when you have dental disease. There are some factors not related to endodontics or the tooth, including fenestration, occlusal trauma, intracanal medicaments, toxic to periodontal ligament, heterotopic pain. So you have to exclude these factors from the odontogenic pain. So first, in order to make an accurate diagnosis, you have to be an expert. In other words, specialist to be successful. So what is an expert? There is a definition of being an expert. Person who has comprehensive or authoritative knowledge of a skill in a particular area like endodontics. So expert should be expected to make an accurate diagnosis or prioritize the treatment plan and solve the problem quickly with the effective treatment plan. So you have to have three factors to be recognized as a specialist. You need to make an accurate diagnosis, you can prioritize the treatment plan, and you can solve the problem quickly. Not 2 years, 3 years, 4 years. You can solve the problem. You should solve the problem very quickly, at least within one month. So you have to be an expert. What is an accurate diagnosis? There is a definition for the accurate diagnosis. The keystone of effective treatment. You must have understanding of pathological process and recognition of disease by means of sign, symptom, and test, including clinical and radiographic examinations. So you have to make an accurate diagnosis. You have to have understanding of pathological process. You know how the tissue inflammate and also how the disease proceeds. So you have to understand the mechanism of the disease. Otherwise, you have no idea. So actually, Anthony Fauci was recognized as a specialist, infectious disease specialist. But do you think he can be called a specialist? From my point of view, I don't think so. Because he didn't solve the problem during the pandemic. Because it took 3 years after the pandemic was gone. And Fauci actually stepped down on December 31st, 2022. After he stepped down, the pandemic came to an end. So this is a kind of irony for us. So he was not specialist. He was a specialist in making lots of money. So what is a pain? Because when you think about a pain, you have to know the definition of the pain. Pain is an unpleasant sensory and emotional experience associated with or resembling that associated with or actual or potential tissue damage. So it sounds a little bit complicated. So to make it very simple, pain comes from the two sources. One is tissue damage, the other one is from the pain memory. So you can feel pain because of the past pain memory. So you have to understand this. The majority of the dentists just focus on the tissue damage.